Welcome to today's episode of Who Are You? The Bobcats You Know, the Stories You Don't. I'm your host, Joel Vanner, inside the podcast studio at Quinnipiac University School of Communications. And I am joined for today's episode by Jackie Callinan. Jackie, welcome to the show.
Thank you for having me.
So I'm sure you could guess by the name of our show what my first question to you is going to be. We know your name, but who are you?
I am Jackie. I am currently a second-year physician assistant student here at Quinnipiac. I'll be graduating this upcoming August, which is crazy to think about. But I've been at Quinnipiac since 2019. I did my undergraduate here in health science. And now, been here ever since.
How did you know that health science was a field you wanted to study in college? Was there some moment in your childhood that said, this is what I want to do? Walk me through how you ended up here.
Yeah. I think the craziest thing when thinking about that question is that I kind of didn't have a solid concrete moment growing up where I was like, medicine's for me. My mom likes to say that when I was young, I was always really interested in my siblings' injuries, their Band-Aids, their cuts.
Dr. J, right?
Dr.
That was your nickname.
Yeah. Unfortunately, PAJ doesn't rhyme as well with the syllables, but
we can roll with it.
We can roll with it, yeah. But there's even this one picture that my mom has that it's me maybe 1 or 2 years old, looking and touching my sister's Band-Aid. And I think that just defines how I grew up loving medicine. I loved science in high school with biology and chemistry, which I feel is not really normal to love AP chemistry that much.
That one especially.
But, yeah. But I kept taking anatomy courses, forensics electives, and then I learned about what the PA field was, and ever since then, it's here where I am.
And when you were in high school, you volunteered with an ambulance agency, right? Mm-hmm. Tell me a little bit about what you learned from that experience and how maybe that directed you into where you wanted to study.
Yeah, I mean, I joined that agency when I was about 16, so pretty young. And I think that was really important for learning how to grow in confidence and decision-making skills, and also putting all of the science and education that you've learned in your head to actually real life. They kind of say it's the head-to-hand transition. So I loved it. I mean, I remember the first training session we had, and it was on it was helping extract a pedestrian from underneath a car, and we were down on the ground, using the device to help get the patient out.
And you were 16 at this,
and I'm 16,
right?
yeah. And then what's even crazier about that is once you hit 17, they let you advance more into more roles in the organization. So at 17, I started dispatching. So when all the 911 calls came in, we were responsible for sending out all the ambulances to the locations. If the ambulances, they said, we need more backup, or we need another ambulance because there's multiple patients. Or even, we need you to call 911 so that the helicopter can come transport our patient to the trauma center. At 17, I was like, okay, I'll be calling 911 for the first time and asking for a helicopter. But then that was a great transition to then riding on the ambulance as a first aider, which is basically an EMT aide. And then I was able to get my EMT license and start doing the care on my own, leading a crew at 18. And that set me up really well for PA school.
So you had all of these experiences. Tell me a little bit about how those experiences led you to come here to Quinnipiac.
Mm-hmm. So it's actually a pretty funny story. So like I said, I was very interested in science in high school. And I was also a high school student athlete, did track, cross country, lacrosse. And they had us do a student leadership thing where we would help at the front desk certain mornings of the week. So I did that, and I got really close with the secretary, wonderful woman, and I was always there studying or stressing about college applications. So one day we were just out on a cross country run, 20-minute run, and one of our girls just sprained her ankle, got hurt, and I was like, I'll take any opportunity to walk during a run, but also, making sure that she was okay. So I was like, hey, it's okay. I'll walk back to the school with you. Like, let's just get you back. We can get you some ice, help. And as we were walking back, that secretary actually ended up seeing us as she was leaving work. She pulled over. She was like, hey, girls, like, get in the car. I'll drive you back to the school, get you back to coach. And I remember I was sitting in the front seat with her, and I was talking about my ACTs, something like that. And she was like, Jackie, just stop worrying. My daughter worried about her ACTs too, but she still went to Quinnipiac, went to the ELMPA program, and she just graduated PA school, and she's doing great. She's got a job in surgery in New York City. And I was like, oh, okay. And I think she had told me about the ELMPA program before, but it never really registered.
There's a lot of things that swirl around your head at that point of your life.
Yeah. So I just remember going home after that practice, sitting on my couch and like looking up the Quinnipiac ELMPA program. And I was like, oh my gosh, like these are all the courses I want to take in undergraduate. And then I looked at what a PA is, and I researched, and then I like looked at the PA courses, and I was like, oh my gosh, like this perfectly aligns with what I want to do. And even like they had an EMT course as part of the curriculum sophomore year. And I was like, wait, this is awesome. So I actually think that when I found out about Quinnipiac and the PA program, it was like maybe less than 3 weeks to the application deadline. So it was a really quick turn of events, but now I'm here 6 years later.
Now you're here. And ELMPA is the abbreviation for Entry-Level Master's Physician Assistant Program. Yep. So tell me a little bit about, so your undergraduate was in health science studies. Tell me a little bit about your undergraduate experiences that you had here.
Yeah. So I think what really defined the undergraduate experience for me was how it kind of morphed into this focus on the global South, which was really surprising and not something I expected. So my freshman year, I had an open space in my curriculum in the spring semester, so I decided to apply for the International Health Research Trip. So surprisingly, I got accepted, and then it was a course based in Nicoya, Costa Rica, which is one of the 5 blue zones of the world. So like one of the regions where the majority of the population there, or like a certain percentage, lives beyond the year 100. And a lot of researchers are trying to like find the common factors between those regions across the world, evaluating like what makes them so healthy that they can live to beyond 100. So that was great that we got to do some on the ground, like blood pressure, gait analysis, gait and grip strength. And we really got to engage with the community, go down there and learn about health from a different perspective. How
long were you down there for?
We were down there for a week. Actually, the week before COVID happened, and we were getting all the emails from Quinnipiac at poolside, which was kind of crazy. But so we were there for a week. And then my junior year, I did a J-term class, which was, starting more from the beginning, I ended up switching to a Spanish minor at the beginning of my freshman year because I had learned French in high school, but I realized that in that local EMT organization and here as well, there was a lot more Spanish-speaking patients than French, and I really just was frustrated that I couldn't communicate with a lot of these patients. So I ended up enrolling in Spanish 101 my freshman fall, and then working towards that minor throughout. So from like that minor, I learned about this J-term program, which is like the January term. Mm-hmm. And I took Exploring Global Engagement, I believe it was called, with Professor Sabato. And that class was actually the majority of our class was Nicaraguan students from like our Quinnipiac Alliance down in Nicaragua. And that was wonderful, and like being able to just connect with these students our age, like across the globe, and learning about just global solidarity, global engagement. And I think we still have our Spotify playlist that we all put on our favorite songs that we could all like listen to. And I think then later on, because I really want to study abroad, just with like some countries still coming out of like COVID restrictions and COVID precautions, I ended up taking this semester off to go do I ended up taking the semester off to do a 3-month rock climbing and backpacking leader course in Argentina, which was phenomenal. It was one of the favorite decisions and things I've ever done in my life. But I don't think if I had those 2 experiences at Quinnipiac, I would have felt comfortable or confident enough to do that.
So tell me more about the rock climbing experience and how that fits into the other experiences you had.
Yeah, I think, it was a great challenge, of course, to be fully immersed in like a Spanish-speaking environment. I really got to practice my Spanish, and even though I was corrected multiple times down there, it was still okay. But what I really took from that experience was the importance of like having an important work-life balance moving forward, because I just realized how much I love to do rock climbing and hiking, and how I really wanted to keep that as part of my life, not having a life just dominated by my like professional career. But even the first week down there, we were able to witness a helicopter rescue on one of the mountains. So actually, where I was in Patagonia, which is, my town was the logo of the Patagonia. So it was a rescue on the big mountain in the middle. And I just saw the entire town just drop what they were doing and mobilize to go hike out, and then also like climb up to go rescue those climbers and provide medical aid. And I was just like, wow, like this is something I want to do in the future. I want to have the hiking and climbing skills to go get to the patient, but I also want to have the medical skills that when I get there, I can provide aid and I can be both parts of that equation to help people.
And how do all of these experiences abroad that you've had, how did all of those connect to your studies here at Quinnipiac?
I think what it really came to was applying a sense of context and compassion in the diversity of the patient populations that we are expected to give care to. We had a course in our graduate program called, or we talked about like the social determinants of health, which are like the non-medical reasons or the non-medical factors that end up influencing a person's health, and many aspects to that, like their culture, their cultural beliefs, religious beliefs, the environment they grew up in, even the the existing socioeconomic barriers that come into place. So I think it also prepared me well in that I can just give an example. Like I was on my family medicine rotation and really busy practice in a more underserved area. And I remember my first day going into a room, and it was just, there was not a lot of resources. Like we didn't have like the telephone translator services that a lot of hospital systems have. And there was only one person in the office who spoke Spanish. And so we went into the room, and we were trying to communicate, and they didn't speak a lot of English. And I just started speaking, and I just tried, even though my grammar was awful, but I was able to, use my Spanish. At that practice as well, I was able to work with some immigrants and refugees who were getting like their immigration physicals, and like help them with their vaccines and such. And so I was really prepared to, strike up a conversation with them. Like, how are you doing? Like, oh, where are you coming from? Like, how has the transition been? And then I think also that lens of like global solidarity from undergraduate caused me to pursue learning more about that in the graduate program. So I joined the Quinnipiac. It's like Connecticut area health education centers, like multi-university program that involves Quinnipiac. That is a program focused on rural and urban underserved populations and those health disparities. So I really got to learn about more of those health disparities. I I was able to do like a blood pressure screening and like diabetic foot education at the Northern Connecticut Native American tribes like fair. So we were like doing like the circle dances with the tribal members. I was able to research and produce a podcast on health disparities for the recently jailed or incarcerated. And then like even in that same family practice, we had a lot of people who were recently released from prison. And I was able to use that knowledge being like, okay, what services do you need? Like, do you have difficulties getting your medications? Did they set you up with any follow-up appointments when you left jail to like control these things, control these medical issues you have? So I think it all like has come together in my clinical year, if that makes sense.
Absolutely. And the ability for you to step in that experience and just communicate with those patients and make sure that they were getting answers to their questions, they were able to ask questions and understand the care they were getting. How have all these experiences helped you grow throughout your time here at Quinnipiac and make you into the person you are today and going into the workforce, getting started there?
Yeah, I think that's a really good question. I mean, I think that it's really grounded in myself a sense of importance of community and understanding understanding that we need to do so much learning about other people, other groups of people, because in real life, like the patient population I'll see when I graduate in August is not homogenous.
It's anybody that walks through the door.
It's anybody that walks through the door. So it's really trained me to want to learn more and want to do more to help a diverse amount of patients. I mean, I think in terms of going into the workforce soon, so yes, like it's one thing to learn about all these existing disparities or the differences, but it's another thing to actually take that information and apply it. So I can't wait to be like an actual like certified PA, medical provider, and start doing this, keep doing these clinics, keep doing these educational events, but also maybe like use my position for advocacy. I mean, I just wrote my first written testimony for Connecticut state legislature bill that would change the law to allow women who are incarcerated to receive mammograms at a facility closest to them, which is just really important basic health prevention and health education. Like we know that mammograms reduce mortality. And if I can use my experience, my clinical experience, my position as a PA to help contribute to some of those changes, I think that would be really worthwhile. And also, who knows, like maybe I can dream big one day and combine this health lens and this global solidarity, this culture, this love of language, and, maybe like try to join a UN task force, work for the Olympics.
Maybe you'll find yourself at the top of Patagonia again.
I would love nothing more. And exactly, like even like being maybe as a PA, I can work at an embassy abroad, or in my free time be a volunteer search and rescue PA, like wherever I end up. So it's really exciting to think of how many opportunities or how many routes I can go down in the near future. So
we talked about confidence. You talked a lot about being able to communicate. If there's somebody listening to this podcast and they're like, I want to be just like Jackie, but maybe they're a little scared, like they don't know where to get started, right? Mm-hmm. All those experiences, they're a lot to have. And this is all in college, right? What advice would you give our listeners or our watchers who may want to follow a similar path and have that global experience and get all these different experiences in their tool belt? What advice would you give them to even get started? You started volunteering with the EMT organization, but is there some other motivation that's kept you going that maybe you go back to in times of uncertainty?
I think one core piece of it is just finding what excites you, even if it's small, and starting from there. So I just simply loved going into my EMT shift. I had so much fun. I never knew I was going to expect the relationships that I made there. And then once you enjoy something, it just dominoes effects and it leads you to the next thing. So, maybe finding a language that you really love learning and practicing speaking, and then you'll see where it takes you. But also in that regard, I would give the advice that it's okay to be a bit uncomfortable. Like in all of these experiences, I took the leap. It's like, I don't know if I'm the most comfortable going to Argentina on my own or trying to speak Spanish in a class of a majority of people from Nicaragua when I'm in my grandma's room and my entire family can hear me mumbling Spanish in the other room. And then even now, like, as like a student is like finally like the discomfort to try to tell a preceptor a treatment plan or try to speak Spanish to someone. But you just got to be okay with being a little uncomfortable at first, and then
be unique too, right? Yeah. And when you're getting started on your journey, find what makes you unique and take advantage of the opportunities you have that way.
Yeah, and then if you stay true to yourself and like what makes you happy and what some people reference as like your why or your passions, then I think things will come naturally to you, and that's wonderful to just grab by the reins and just go with it.
Well, Jackie, that's all the time we have today. It was a pleasure having you on the show. Thank you for coming on and sharing your experiences and advice. And best of luck as you prepare to enter the workforce soon.
Thank you.
If you like today's episode, be sure to like, subscribe, and share, and find other episodes of Who Are You on Apple, Spotify, and YouTube podcasts. Until next time, when I ask my next guest, who are you? I'm Joel Vanner. Bye for now.